Welcome to Ask the Oncologist. In this video, I will be taking you through some top 5 warning signs of cancer. Cancer has many signs and symptoms that can emerge from the beginning. However, in this video, I'll only take you through some top 5 ones. So in no particular order, the first I want to mention is noticing a lump or a growth in a particular part of your body that did not exist previously. Often I'll get patients coming in who have noticed a lump growing either in their breasts, in their leg, somewhere in their head, or on their thigh somewhere. And most of them will ignore this for several years until they realize that it's too late. So if you notice something unusual growing in any part of your body that did not used to be there, and even more especially if you realize that this particular growth is constantly increasing in size, or it's been there for a long time and it's not decreasing in size or it's not going away, then this deserves notice. So when it comes to specific cancers like breast cancer, we often ask the women to have a monthly habit of examining their breast. This will help you to be able to notice if there is any lump that is in the breast, and then you can report to your health provider as soon as possible. This is not for only breast alone, for any other part of your body. You need to know your body so that if anything unusual develops there, you can monitor it and report to your healthcare provider as soon as possible. The second sign and symptom I want to talk about is unexplained weight loss. It's a different thing when you hit the gym with the aim of burning down some fat and you realize that your weight is beginning to go down. For example, if you decide to go through a period of fasting, or if you decide to go through a period of dieting where you cut down your intake and you begin to notice that your weight is going down. However, if you realize that your weight is beginning to decrease, your weight is beginning to go down without any intention, without your diet changing, without you intentionally hitting the gym and doing something, this might be something of concern. It's not always, but it might be something that you want to check up or check it out with your healthcare provider. Another sign and symptom that I want to mention is bleeding. Bleeding from any of the orifices. Somebody can have bleed from their nostrils. People can have bleed from their penis, from their vagina. There can be bleeding from the ears. There can be bleeding from the mouth. Unusual bleeding, unprovoked bleeding. Unprovoked means there has not been any activity that may have initiated or may have traumatized this part of the body. Meanwhile, you notice bleeding. This might be something that you want to check out with your healthcare provider. So another sign and symptom I want to talk about is chronic cough, or a cough that does not go away. It's one thing if you get a cold and then you cough for a few days and the cough goes away. However, if you notice that you are beginning to cough and this cough is getting worse, it's been weeks, it's been months, and the cough keeps getting worse and it's not going away, this might be something you want to check out with your healthcare provider. Because most of the patients that I see who present with diseases like tumors of the lungs, cancers of other parts of the body that has spread to the lungs, sometimes do have coughs that do not go away. So it might be something that you want to check out with your healthcare provider. Chronic fatigue. You just get tired. You have not had a hard day at work. You haven't gone to carry out some physical activity that warrants you being tired. But you've recently noticed that you are almost always very tired, as if somebody who has gone through a lot of work. It might be something that you want to check out with your healthcare provider to find out that there is nothing unusual about your system. Another common sign or symptom that might be of concern, which you want to check out with your healthcare provider, is pain. Now, pain usually is not a starting symptom of cancer. However, when tumors develop in a particular part of the body and gain a particular size, they begin to compress on neighboring tissues or neighboring cells. And that compression on those tissues or cells can induce your body to begin to respond to that pressure in the form of pain. Not to say that every pain you experience is a sign that you are having cancer, but if you begin to have unexplained pain, for example, abdominal pain that has been persistent, that has been coming on and off, or that has been worsening over time, or if you're beginning to have pain in a particular part of your bone with an associated mass, it might be something that you want to check out with your healthcare provider. If you begin to have, for example, a headache, a persistent headache that is associated with convulsions, some blurred vision, this might be some signs and symptoms that you want to check out with your healthcare provider. Thank you very much for making time with us, and always keep watching this space because more videos are going to be rolling out that are going to be educative, and I'm sure you don't want to miss any of these videos. Don't forget to subscribe to this channel. Thank you, and see you in our next video.